that said, everyone, thank you so much for joining us today. My name is Danielle Salmon, and I am the Public Affairs Representative here at Kaiser Permanente, and I will be the moderator for the event today. To start everything off, I did want to say thank you so much to the Culver City Chamber of Commerce for putting this event together, and especially for doing all the hard work behind the scenes. We kind of just showed up, and we were super appreciative to you guys for doing all that. As I wanted to do.
Yep.
See, I turned my mic back on because you have feedback. So I turned it off, but it obviously all linked. So I see it. So it's back on.
We're claiming to be Bill Gates over here, and it's working. But like, if at any point you hear some audio changing, just give us a signal. What you guys did was perfect. So thank you. You guys can hear me okay? Perfect. Perfect. Okay, so with that, what I wanted to do is really give a brief introduction to all the speakers, and then really just throw it back to you guys so that you can give a better description of what you all do, okay? As well, we do have a section where we're just going to be asking some questions, and then if I can have you guys answer it as best as you can, that would be awesome, because you guys are the experts on this, and I think coming from you, it will really provide the members that we have on this call right now. So with that said, like I said, my name is Danielle Salmon. I'm with Kaiser Permanente. And on this call, we do have Dr. Jeff Smith with Cedars-Sinai. We have Dr. Latanya Hines here with Kaiser Permanente, Baldwin Hills Crenshaw. And we also have Steph Schuyler McCall. Did I say that right? I know I did it.
No, but that's okay.
At some point, please do. But at the same time, she's with the incredible CycleBar. And with that, I would like to throw this first to Dr. Hines to give us a brief introduction about her and what she does with Kaiser Permanente, and then she'll send it back to me, and I'll throw it to one of you guys next.
Good morning, everyone. Thank you so much for participating with this call. I look forward to a very long, especially given what's been happening in the world. I'm Dr. Latanya Hines. I'm an obstetrician gynecologist. I am one of the physicians in charge here at the Baldwin Hills Crenshaw Medical Office Building, which we are one of the largest medical office buildings here in Southern California, but also perhaps in the country right now at greater than 100,000 square feet. I'm also assistant clinical professor in obstetrics and gynecology at the new Kaiser Permanente School of Medicine. And that's it for me. I've been in practice now for approximately 19 years, and 10 years of that was spent in private practice in Pasadena at Huntington Memorial Hospital as a solo and as well as a small group practice. Nice to be here. Danielle?
Perfect. Thank you. Steph, do me a big favor and please pronounce your last name so I can get it right, and then also tell us a little bit about yourself.
No worries. Hi guys, I'm Steph Schuyler Mulcahy. You can just call me Steph. It's a lot of consonants there, so we'll just ignore that second half of my name. I'm the owner of CycleBar Culver City in Santa Monica. We are a boutique indoor cycling studio located on Washington and Sepulveda. Since July 13th, we've been operating outdoors. We're at 50% capacity right now, and have our bikes socially distanced, and have been working really hard to keep all the residents of Culver City and the surrounding areas healthy and keep their immune system up and just get a little bit of a community feel, because right now people have been so lonely. And so what we hear from a lot of our riders is that they go to Trader Joe's and they go to CycleBar, and that's it. So we're happy to be a part of their daily routine, but also really committed to keep everyone safe and still moving so that their immune systems can stay really strong during this difficult time.
Perfect. Thank you so much, Steph. With that, let's throw it down, last but not least, to Dr. Jeffrey Smith.
Hello, good morning, everybody. I'm Dr. Jeff Smith. I'm an internal medicine physician by background. I'm currently the COO for the Cedars-Sinai Medical Center here at our Los Angeles, West Hollywood location, as well as being the CEO of our Marina Del Rey Hospital. So I'm responsible for the day-to-day operations of both of those sites, as well as help leading the team that is handling our COVID response and preparations. It's my pleasure to be here today.
Perfect. All right, guys, before we hop into questions, let's do this first. We have healthcare, we have wellness on this call. So starting, can you give us an idea of your perspective on the industry outlook as a whole right now?
Well, to be quite honest, right now the fitness world is really taking an incredible hit. A lot of the industry has moved to online and doing virtual classes, which is great because it's still keeping people moving. But those of us that do have, especially for me, where you have to have a really specific piece of equipment in order to do our workout, it makes it a little bit challenging right now. So, with everything, it's been such an unknown. And I have to admit that when we were first able to open back at the end of June, it was really hard to go to work because I had such anxiety about keeping everyone safe and making sure that we had a place that, where we weren't going to spread COVID or people weren't going to catch it there. And it made it really hard to go to work. And it's gotten a little bit easier as we've gotten the hang of it, but it's just so difficult right now because even though we are able to operate and we are doing, taking the necessary actions, there's just a fear, and I get it. I'm scared myself, but and just trying to get, what I'm worried about is, once things do kind of start opening up, is that fear still going to be there? But what we found is that while we were closed, we really tried to keep in touch with our community and keep it strong, and we basically tasked all of our staff to reach out and make phone calls and text and whatnot and just see how people were doing. Because really right now what we're finding is just not only are people's physical health kind of going down a bit because they're taken out of their routines and they've joined one too many Zoom happy hours, but just that sense of that person to person, that mental health aspect is really taking a big hit. And it's made me realize how important we are in our community to bring those people together. And so, it's a really difficult time right now, and keeping our head above water is tough while we're trying to deal with all the ever-changing mandates and whatnot. But I'm just trying to stay on top of it and do everything I can to make sure that we have a safe space for people to cycle.
Thank you so much for that. Dr. Smith, same question. How do you feel the industry outlook is for you over at Cedars-Sinai?
Well, things are really challenging right now, of course, especially as we're now facing a significant surge in COVID-19 in our communities. And so we are really focused on providing access. And that means that making sure that we have enough beds, making sure that we have enough staff and equipment, enough supplies, including the personal protective equipment, so that we can be available to serve not only the COVID patients, but all of the other patients out there who need to be seen and cared for. And that is very difficult and really putting a strain on our staff who've been so diligent through this time. We have had some time to prepare, throughout the months of the pandemic now. Largely, we have an adequate supply of the personal protective equipment that we need. Staffing is becoming the most significant challenge, especially as most parts of the country are surging all at the same time. So finding extra staff has been particularly difficult. I would say that many hospitals are also facing a significant financial strain, especially back in April and March when most hospitals were forced to shut down to elective procedures. That had a very significant negative impact. The cost of purchasing all this additional personal protective equipment that's necessary. And so, fortunately, big systems like Cedars and Kaiser Permanente will likely weather this fairly well in the end. But we have over 100 smaller and independent hospitals across LA County that had small to no margins to begin with, that are really trying to serve their community, and I think are going to continue to be challenged.
Understood. Same question for you. How do you feel the industry outlook is here at Kaiser Permanente?
Well, it's not an easy question, but I'll take it this direction. There are 15 regional medical centers here in Southern California, and all of us, instead of being individual medical centers, have become one. And so there is a philosophy, as we spoke previously, many years, it's one KP, not Kaiser Woodland Hills, Kaiser Kaiser West LA, it's one Kaiser. And that means that the resources that we can utilize and mobilize are from all of the medical centers, and making sure that we have enough staffing, that we have enough beds in ICU, that if we need to shut down elective procedures, which actually have been done for the next 3 weeks in order to increase capacity for the utilization of the respiratory equipment if we need more respirators, but also making sure that the urgent care and the ER are not overwhelmed when we were trying to just do regular care. We have significantly pivoted since March of this year to virtual care. We have an entire virtual medical center that is in the ethos, and it does everything that they can with all of the physicians staffing it and the nurses to make sure that your needs, if they can be met virtually, are. That does not mean that we don't see you. We do encourage you to come in for your routine care as necessary. Right now, knowing that last month our positive rate was 7% and now it's 21%, we're testing over 400 people now at our center, which is Baldwin Hills Crenshaw, for COVID, and we've seen a significant increase in the percentage of asymptomatic patients. So I second the motion, and I'm right behind Dr. Smith with regard to what's happening. Now, I am just one physician in administration here. I am not, as I would have loved to have our medical director here, which is Dr. Tamadon, who could give us a lot more detail. But ultimately, Kaiser's philosophy is one philosophy. All the Kaisers, whether it's Southern California, Northern California, Pacific Northwest, Baltimore, Colorado, and the South and Atlanta. So we are all working on the same premise that we are one unit in trying to make sure that we can weather this storm. We anticipate next year is going to be difficult. And that's because of what we have done this year in trying to prepare. So staffing is an issue, and we're just doing our best in this time.
Thank you so much for that. I think it's pretty obvious that COVID-19 is a really negative situation that many of us are dealing with, and we can't shy away from that. But I also don't want to focus too heavily on that. Knowing that that is there, tell me, Dr. Smith, we'll start with you, with one of the best qualities or the biggest strengths of your facility and medical center and what you're doing in COVID-19.
Yeah, thank you. So certainly, at Cedars-Sinai is well known for its high-level tertiary and quaternary care. So we are accepting patients from other areas who are requiring specialized services like ECMO, which is essentially putting patients on a heart-lung bypass machine while they recover from COVID. So we certainly are taking care of high acuity patients. We too have over 100 clinics spread out across our region, and we want to be there for patients. And so also providing telemedicine and connecting our patients to care in that manner as well. And so it really is an entire system effort, and we're forced to become much more agile. I think all healthcare systems are, and all businesses are. Steph's business as well has been forced to change dramatically. And so, in healthcare, we often move relatively slow. We like to test things before we do it. Here now, in response to the pandemic, we're learning to be quite innovative and try new things very quickly in order to adapt to the current circumstances.
Thank you for that. Dr. Hines, same question for you. Tell me a little bit about the strengths that you're seeing in your organization and also with your staff as well.
I would say that our people are our biggest resource. They have given us sometimes some of the most innovative ideas about how to integrate some of the very quick things that we're doing. The video visits, they are all integrated with our Health Connect system. We have the same system, Epic, as Cedars does, as well as UCLA. And so we can integrate the video visit, the telephone visit, and switch back and forth. It's on all of the telephones for all of the physicians. And then also that the patients have the opportunity to go to any of the regional centers and the MOBs throughout Southern California. So you're looking at 7,000 physicians, 85,000 plus staff members. And I think what we do best is meeting you where you are. If you need to be seen, we can make sure that you get seen. If you need a virtual visit, if you need, same thing with even the pharmacy. We are delivering medications a lot faster, so you can go online and order your medication, get it approved, and get it to you within 48 hours. We will deliver the medication to you. If you drive up to the pharmacy, you don't need to get out of your car to get it to you. So where the convenience is and where we can meet you for that demand is what we're doing. It is putting a lot of stress on the staff, and we're seeing that. And we're doing our best with mental wellness. I want to bring that up. That's important, that it's not just staff, it's the physicians, and of course, it's the patients, and making sure that there's free access to the app, Calm app. Everybody can get it for free here at Kaiser, whether you're staff or the patients. And we encourage Headspace. We encourage to acknowledge that this is a difficult time for everyone and that we're doing our best each and every single day.
Thank you so much. Steph, same question. Tell me how everyone at Cycle Bar is standing up and rising to the occasion. That makes you really excited.
Yeah, I mean, I think a lot of it, I just have to throw it out to my staff. I mean, every week when we first reopened was just like, okay, now you got to wear masks. Now you got to wear gloves. Now you got to do this. Now you do that. And, you know, just being able to get the information, push it out, and then have everybody adapt to it and follow it. I mean, yeah, I mean, you're only as good as your team, but really, I mean, it's such a group effort when it comes to following safety protocols. Like I said before, my biggest concern when I reopened was just, how do I keep this place safe? How do I make sure that my staff doesn't get COVID? How do I make sure my riders, how do I make sure I don't do it? I mean, we literally look like we're going into a hazmat situation. We were masked and face shields and gloves and long sleeves. I mean, we took it very, very seriously. And, you know, just pivoting to moving outdoors and changing the way that we operated and interacted with our staff and our riders, but still making sure that everyone, that it was fun and it wasn't like for lack of a better term, like a hospital experience trying to get a workout. You know what I mean? We're a community of a lot of high fives and hugs, and that's just turned into a lot of air high fives and clapping your feet together or something so that we can still feel that interaction. And, you know, I just really, I think that people really appreciate everything that we've done and all the efforts that we've done to keep them safe. You know, we took everything down to our studio into a one-touch facility, meaning when people come in, we do our temperature checks and hand sanitizing. But the good thing about the way that we operate is there's only one piece of equipment that each rider has to touch. And so they come in, they don't have to check in with anything. We set it up so they can check in on their phones and they go directly to their seats. They do their ride and then they leave, and then we come in and do a deep clean. So it's not a lot of socializing anymore. There's not a lot of, you know, we're not hanging out and touching things, you know, we're keeping our distance. So, you know, it's been very positive to just see how people have been, like, we've been so fortunate to not have those people that, you know, cause problems. They want us to stay open. So we've received that support from our community, and they've all been adhering to all the rules that we keep throwing at them. So hopefully that answered the question.
No, it does. Thank you again for that too. Let's get into something a little bit deeper now. We're now in December, about to hit the new year, and we're at a point of coronavirus where we're talking about a vaccination, which is big and also could be kind of a little nerve-wracking for some people. Tell me, starting with Dr. Smith, let me know what you think rollout of a vaccination.
Yeah, well, this is a really exciting time. We are expecting the FDA to meet tomorrow and to approve the emergency use authorization for the Pfizer vaccine, and we expect the Moderna vaccine to follow shortly thereafter. And here in LA County, we're actually anticipating some of our first shipments will arrive as early as next week. Those vaccines have been prioritized by the CDC for healthcare workers, particularly those who are on the front lines directly caring for COVID patients, and who may also be at high risk because of their age or other medical conditions that the healthcare workers themselves have. In addition to that, we will be assisting in vaccinating residents of nursing facilities or nursing homes, which are also at very high risk. The good news is that so far over 70,000 people have received these vaccines. They've been shown to be very highly safe and effective. And so although they've been developed in record time, no steps were skipped. many of them were done in parallel. And so right now, the news is good around the vaccines. We look forward to being able to start vaccinating first healthcare workers, then the most vulnerable patients, before it will become available more broadly to the public. And so hopefully that will be a key turning point in this pandemic.
Thank you. Dr. Hines, can I have your perspective on that question too?
I am, as best as I can be, very evidence-based and science-based, and that's the way that we will approach it with regard to Kaiser Permanente. Having been over the past few years an administrator here at Baldwin Hills Crenshaw, this is a community in which there is a lot of hesitancy with regard to the vaccine because we serve a very diverse and underserved population. So there is a thought that perhaps they will be guinea pigs or that this is not going to be as safe. And so it's going to be a little bit of an uphill battle here in my community to make sure that people understand the importance of the vaccine, what it can do, what it's not going to do, and look at it through that lens. Kaiser is on board for making sure that as many of our members who will accept it will be vaccinated, because that's going to significantly decrease the incidence of the virus in the population, and of course decrease the incidence of transmission of the virus. But that taken, it is going to be a little challenging, even as we are starting to notice with kind of inquisition, even from some of our staff members about, is it really safe and what's the efficacy versus the safety profile. So we are all out with a very positive and informative campaign to make sure that people understand that we are on board to make sure people get the vaccine.
Dr. Hines, I think what you just mentioned is a very important point. The education around this is going to be so critical, and you're right. We do have some parts of our community who have been disenfranchised or underserved and taken advantage of in the past. And unfortunately, those communities, mainly minority communities, are often the ones who are at highest risk of either getting COVID and suffering the consequences of it. So you're absolutely right. Reaching out to those communities, those diverse communities, is going to be absolutely critical.
Thank you. And Steph, I know you may not be able to allude too much considering the vaccination, but when it comes to mental health, making sure that people are in a good state of mind and also physically are okay, what offerings do you guys have at Cycle Bar that can really help them out?
I mean, really just the experience of getting people out of their homes and moving, you know, and also just being a resource to our community. What I found is, you know, especially a lot of people that suffer from anxiety, which seems to be a lot more lately, you know, they come to us and we're actually just there to listen. And that's not only for my riders, but that's also for my staff. You know, there's a lot of this feeling of alone and a lot of this feeling of, you know, just not a lot of positivity. So where we're still trying to operate and deliver a cardio workout, we're also there to, like I said, just listen to people, because a lot of times, a lot of the anxiety can be relieved by just someone having a sounding board, especially those, you know, that are home alone. I mean, truly alone, no partners, no pets, no kids. I mean, it's got to be incredibly difficult to just feel so isolated right now. So we're just trying to be, again, that resource. And, you know, there's a lot of people that used to come to us that are still afraid to come, and that's fine. And so we still reach out to them and try to be there for them. And so once the vaccine is more widespread and people, or once it becomes widespread and people feel comfortable coming back, you know, we'll be there for them to welcome them back into the studio. And, you know, it's going to be a long process. You know, I think when this all started, I was looking back through my social media and it was, hey guys, we're shutting down for 2 weeks. It's just so funny to think that never did we think we'd be this far ahead. You know, and I've kind of let go of the, well, maybe next month. You know, I'm looking at it more as probably next summer we'll be back to running somewhat normal and possibly back indoors. And you know, as long as we can just sustain and be a safe place, you know, that's all we can be. But you know, all the mental and physical health is so like they're so married to one another, and just having the conversation about it is great as well, because I think a lot of people don't open up about it enough, and that's where we kind of see a lot of problems, you know, with our community.
Exactly. And I think, Steph, you said something really exciting there where you're alluding to the idea of looking towards the future. So Dr. Hines, Dr. Smith, Steph, if we can all pretend that we're looking in the crystal ball of the future, what do you envision recovery looking like? And are there any tips that either of you guys can offer to help a person stay safe, stay healthy, and keep their immune system up? Dr. Hines, we can start with you on this one.
I would say that this too shall pass. That this is not the first time, and unfortunately, it will likely not be the last time that this country or this world will have to deal with a pandemic. I would like to believe and know in my heart that we have gained the kind of knowledge with this experience that is going to last and make us a lot better as people, as a country, as neighbors, for the future to come. I am hopeful. I am one of those kind of positive people, optimistic, that, you know, all things are possible when we work together. We have seen what happens when we don't. So I am going to believe that in the next year, 2021 will be one of the best years because we have had 2020. So I hope that they're comfortable and positive about accepting the vaccine when they feel comfortable to take it, that they are drinking lots of water, exercising when they can, taking advantage of cycling, washing their hands, using antiseptic, wearing their mask. There's nothing political about any of that, and keeping their health in the best way they can. Mentally is just as important as physically. So reading a good book, turning off the television, getting some fresh air. These are things that are going to last and sustain us for the times to come. So I'm hopeful that things are going to be better because I believe they are.
Dr. Smith, do you have any tips or anything that you think would be helpful for people to know on this?
Yes, thanks, Dr. Hines. I really appreciate your positive attitude and outlook. You too, Steph. I'm inspired by the other panelists, and I need to get on a bike or do something. So that's
Come on down.
Yeah, I do think that the masks are going to be with us for an extended period to come until we establish that herd immunity, likely through vaccination as well as continued infection. Unfortunately, the masks and some of those practices are going to be important to continue to adhere to. And so it's going to be a dark couple months here. We have seen, rapid rise of cases in our community, and many of our hospitals are nearing capacity. So we need people to take action now, personal action. And that personal action is wearing your mask, maintaining those safe distances, not congregating with others outside your household, so that the hospitals can recover enough to be able to provide care for you and your loved ones when you need it. So if we can do that, and we know we've proved it here before, that by following those behaviors, as we did back in March, and as we did again in July when we saw a peak, that they work. And so we need to do that in order to buy us some time to get through the winter, so that more of our activities will be outdoors, and we start vaccinating the public. And so I think that we're in for a tough couple of months here, but I too am hopeful about the future, about what the vaccine will do, and about the importance of working together across our communities. I think, we've also recognized during this time that there's been a focus on healthcare disparities and inequity, and I think that is something that we're all also working on. That's been hopefully a good thing that comes out of 2020 as well, as a spotlight on health disparities, and how and what we all need to do in order to address those as well.
Thank you. So Steph, before I actually have you answer the next question, I did want to say we're running into our last 4 minutes. And so instead of having you answer that in particular, I prefer, Steph, if you could let us know, what is the best part about CycleBar? Dr. Smith, I'll ask the same question to you about TDIS. And Dr. Hines asked the same thing about Kaiser Permanente. But as just a regular person, tell me, Steph, what is your favorite part about CycleBar in 15 seconds or less?
Yeah, no, I mean, the best part of CycleBar is our community and really just supporting a diverse group of people that come together with one goal, and that is to just feel better about themselves and to come together and reach our goals together and feel support together. Collectively watching the entire world fall off the wagon has been really difficult to see in the health and wellness industry. So we are here for, sorry, this is going over 15 seconds. We are here for our community to help them bounce back. And, you know, I'm really looking forward to 2021 as a theme of what we're saying is unstoppable, where there are no limits and we will be able to bounce back, and we'll be able to bounce back even stronger together and just supporting one another through the next year to come.
Thank you. Dr. Hines, go for it. And you know what, just like Steph, go for it in a good 30 seconds if you like.
I am very biased, but you know, I got Cedars on the line, but I believe that Kaiser is the answer for healthcare in America. I'm just going to say it. Okay, next, it is the place to thrive. And I know that for those patients who are feeling anxious or just feeling like it's just overwhelming, please know that there are people out there who want to listen, who want to care for you, and who believe that you have yet to achieve your best. We know you have it, and all of us are in this. We really are together. I've got plenty of physicians who I am with that are on the edge. You're right off the edge of the mountain too. So it's not just the patients, it's the staff, it's the physicians. Just know that we can and we will. And if you, the mind is powerful. So the one last thing I'll say, gratitude. Each and every day that you wake up, there is something to be grateful for. When you find that you cannot find something to be grateful for, if you're a Kaiser member, please contact us, because there is something there, and that being grateful makes you feel better and makes you a better person as you go out into the world.
So, Dr. Smith, you probably have the last 20 seconds, but I invite you to be as biased as you'd like to be. Tell us the same answer that you had.
Yes, thankfully, Dr. Hines, there's with 20 million people in our community, there's more than enough patients for all of us. And I look forward to continuing to partner with you and other healthcare systems across our area as we tackle this challenge and look to improve the wellness and health of our communities. And I think, you know, what I'm so proud of here at Cedars-Sinai is our people. It's a diverse community of healthcare givers and staff united around a single mission to improve the care of our communities and of our patients. And so we look forward to partnering with all of you as we do serve our communities and attempt to address their health and wellness. And so it really has been a pleasure once again to be a part of this panel. And I once again, I'm inspired by each one of you as we tackle this challenge and look forward to a bright future.
Thank you so much. Alrighty, guys. Thank you to everyone who has been on this call with us. Most importantly, thank you to Dr. Smith, thank you, Steph, thank you, Dr. Hines. Without you on here, we would just be sitting wondering questions about COVID, but you all gave such really great answers and great insight as well. So thank you so much for sharing your knowledge with us, actually taking time out of your busy day as well. And then lastly, thank you so much to the Culver City Chamber of Commerce. Having this event is a big help for all of us, and we really appreciate what you've done for us. So with that, I let you all go, and I hope you have a really enjoyable day today. Thank you so much.
Thank you so much.
Thank you so much.